As concern about bird flu rises in the U.S., a new study is warning about the virus's ability to mutate in humans. Researchers at Texas Biomedical Research Institute examined the H5N1 strain of bird flu carried by both a human and dairy cattle in Texas. They found the strain in the human had 9 additional mutations that were not seen in the cattle. The findings indicate the disease is becoming more proficient at replicating in human cells. The CDC has confirmed 67 cases of bird flu in humans since April of last year. 1 death has been associated with the disease. As you can see, 38 of the cases are in California, followed by 11 in Washington and 10 in Colorado. Dr. Amish Adalja joins us now. He's an infectious disease physician and senior scholar at the Johns Hopkins Center for Health Security. Doctor, always good to see you. I swear I took and passed biology in high school, but what does it mean that bird flu is mutating faster in humans?
What it means is anytime that this virus gets into a new host, like a human, it's going to face evolutionary pressures and start to change so that it's more efficient, more able to be viable in a human host. So all viruses mutate, and this is why it's so important to do this research. Every time we get a human case, we look at those mutations and we try and understand, is this getting closer to developing the capacity to spread efficiently from person to person? And thankfully, this virus has not been able to do that. Yes, it can infect humans, but it hasn't made enough changes to be able to get from person to person.
Do different mutations of bird flu have different symptoms? Should they be treated differently?
No, not necessarily. These mutations that they're looking at are more about how easy the virus makes copies of itself, how the virus binds to certain receptors on our cells. So those mutations don't really change symptoms or change treatment. However, sometimes you can have mutations that make a virus, for example, resistant to an antiviral like Tamiflu, but we haven't seen those types of mutations in this particular version of bird flu.
So what is the concern level right now, the threat for bird flu to the average person?
To the average person, the threat level is very low. The people that are getting infected, with maybe 3 or 4 exceptions that have occurred in North America, are those individuals who have contact with sick or dying birds or cattle that have been infected. That's where we really need to focus, is getting control of this on our farms. That's where people are getting infected. That's where we don't have enough testing. That's where we don't have enough situational awareness. That's where this has been allowed to spread. And a lot of us fear that it's become endemic in dairy cattle now because there was a lot of inaction early on when this was first identified on cattle farms.
Before we let you go, as an infectious disease specialist, what are potential medical implications of the U.S. pulling out of the World Health Organization?
I think this is the wrong decision. I think there definitely are real reforms that need to happen at the WHO, but the situational awareness that the WHO gives us in the United States to protect our own health security, I think is invaluable. And I think that the more we're at the table, the more likely we are to be able to get the reforms that we need in terms of more transparency from China, more information about the early days of COVID, more efficiency in their response to infectious disease outbreaks. I think if the U.S. is out of there, there's going to be a vacuum that's going to be filled by other countries that we don't want them to fill. And I think the CDC and WHO need to work basically side by side to keep the population safe from infectious disease threats. And I think this is the wrong way to go about it.
Dr. Amish Adalja, good to see you.
Thanks for having me.